Hello and welcome to the next instalment of our alphabet series, and today we're doing H for hyperhidrosis. Now what is this? It is basically excessive sweating, and it can happen to the whole body or certain areas of the body, and today we're obviously focusing on the feet. It is estimated that 5% of the worldwide population suffer with some form of hyperhidrosis. Now it is normal to sweat when you exercise or when you're hot, and in fact each foot on a daily basis normally produces about half a pint of sweat. Now with hyperhidrosis, that is excessive. It is more than that, and it can be quite unpleasant. The feet can feel constantly wet or soggy. It can actually ruin shoes with the amount of moisture that is produced, and it can leave damp footprints wherever people go. So it is quite an unpleasant condition to have. It can also produce a rather unpleasant odour, and that is the bacteria that will feed off the dead skin cells and the excess moisture. And it also makes people more prone to athlete's foot, fungal nail infections, and maceration of the skin, where you can get pitting. The skin can go quite a white colour, it can thicken up, and you get these little almost like holes appearing in it. So it is cosmetically quite unpleasant as well for people. I always advise people to try and keep a diary of when this excessive sweating seems to happen. It can be caused by other medical conditions, and it can be caused as a side effect of some medications, and it is thought that stress is a major trigger for hyperhidrosis. So it is worth seeing what your daily schedule is like, if there are any triggers that seem to cause it. Now, how can you treat this? Well, basically, wash your feet daily. Try and use an antibacterial soap or a soap substitute if soap dries your skin out too much. Creams. It is worthwhile moisturising your feet as well, and there are some brands of cream that actually produce products for hot, sweaty feet, which can be really helpful. Ask your podiatrist for some recommendations on that. Absorbent foot powders as well can help absorb some of that excess moisture, depending on how bad your sweating is. Antiperspirants, you can actually buy antiperspirant sticks that you can rub on your feet that will help manage the sweating as well. Socks are essential if you have hyperhidrosis, because they actually help wick the excess moisture away from your feet and your skin, and so they help absorb that. You do need to be doing natural fibres though, bamboo, cottons, wools. Anything synthetic can actually cause the feet to sweat more. And that is the same with shoes as well. Natural fibres are much better. The plastics and the ones that don't let your feet breathe will exacerbate this condition. And ideally you want to be rotating your shoes around. Try not to wear the same pair of shoes 2 days in a row, because they will still be damp inside, and you can get more infections, bacterial and fungal infections, if you're wearing the same pair of shoes day in, day out. You can actually buy absorbent insoles for shoes as well, and you can buy charcoal infused ones. So if you are finding that your feet are sweating a lot, getting a bit smelly, charcoal infused insoles can help with that as well. Now, if it is a really bad condition, you can get Botox for it. This is a little bit more effective in other places of the body. It lasts for about 3 to 4 months normally, so it does have to be repeated, and I have to warn you, in the feet can be particularly painful. Iontophoresis is actually a really effective way of treating hyperhidrosis for the feet. And you basically pass a mild electrical current through water and through the skin surface. It does need to be done on quite a regular basis until you start to get the desired result, and then maintained from that point. But it is actually a very good option, and your podiatrist or your dermatologist can actually help you with that. Surgery is not recommended for hyperhidrosis of the feet. It's not very effective, and so one of the other methods, and just trying to maintain daily foot health, is much better for you. If you have any questions or comments, pop them below. Keep an eye on NK Sports Podiatry for their next instalment of their alphabet series on MSK podiatric conditions. And if you have any problems with hyperhidrosis, see your podiatrist.